I became a caregiver for my mother a few years ago. She is someone who suffers from advanced dementia, and she is wheelchair bound and she is completely dependent. I didn't want to put her in a home if I was able to take care of her. So having this low dose radiation therapy and getting almost full function of my knee back has helped me to be able to do my daily care with her when it comes to the washing, the bathing, the just moving and transferring her, being able to have normal function and being able to have it without severe pain has taken a great weight off of not only my shoulders, but my physical body as well, so that I'm able to focus more on caring for her and not focus as much on being in pain. Then for my own personal situation, just being able to move about, to be able to work out again and not be in pain when I'm on the bike or I'm on the treadmill, and being able to get back to working out the way that I used to has been a godsend as well. I think I'm most excited about just being able to do the things that I normally was able to do before without pain. When you're living with constant pain, it's difficult to function on a day-to-day basis and to enjoy the parts of your life that you consider quote unquote normal. But being able to have that again, it's been like an absolute gift. To be able to just walk around my house and not be in pain, to be able to sleep at night, turn over from side to side without being in constant pain. And I would definitely recommend anyone that's considering talking to Dr. Randolph about this to make the move and do so, because it's given me back something that I was afraid I wasn't going to be able to get back without surgery.